SARS-CoV-2 infections continue to increase, with each day seeing spikes in communities around the world. It is becoming more vital than ever to relieve frontline staff, our heroes, in hospitals and clinics. Especially in areas where lab testing is limited or not available, there's an urgent need for decentralized diagnostics that provide fast results ready to go when you and your patients need to know. Healthcare professionals all over the world can now rely on an easy-to-use rapid antigen test, providing them with answers wherever they need them. The new Roche SARS-CoV-2 rapid antigen test is an instrument-free, rapid diagnostic test for the qualitative detection of specific antigens of the SARS-CoV-2 virus present in the human nasal pharynx. The test kit is ready to use by healthcare professionals and consists of test devices, extraction buffer tubes, nozzle caps, sterile swabs, instructions for use, and the quick reference guide. The handling of the Roche SARS-CoV-2 rapid antigen test is designed to be convenient. You can store it at room temperature. Once opened, each test can be used within the following hour. With a shelf life of up to 24 months after production, the tests are at your disposal long enough to use up the entire kit of 25 pieces. There are 4 steps to performing the test. Begin by carefully reading the instruction for use. Use appropriate personal protective equipment and handle all samples as if they contain infectious agents. Before opening the test, check the expiry date on the back of the foil pouch. Do not use the test if the expiry date has passed. Now, open the foil pouch and remove the test device and the desiccant package. Take a moment to ensure that the test device is undamaged and that the desiccant status indicator shows valid. When ready, insert a sterile swab into the patient's nostril and swab the surface of the posterior nasal pharynx. Rotate the swab 3 to 4 times and withdraw it from the nasal cavity. You can then place the swab into an extraction buffer tube. While squeezing the buffer tube, stir the swab at least 5 times. Remove the swab while squeezing the sides of the tube to extract the liquid from the swab. Now press the nozzle cap tightly onto the tube. You are ready to perform your test. If you want to prepare a sample from a viral transport media, use a micropipette to collect 350 microliter of the sample from the collection cup or viral transport medium and mix the sample with the extraction buffer. Afterwards, press the nozzle cap tightly onto the tube. Turn the tube and apply 3 drops of the extracted sample to the specimen well of the test device. You can now wait for the test results. For accurate results, allow 15 minutes to read the test. Do not read the test result after 30 minutes to avoid the risk of incorrect results. In the top section of the result window, a colored line appears to show that the test is working properly. This is the control line C. Even if the control line is faint or not uniform, the test should be considered to be formed properly. In the case of a negative result, only this line appears. In case of a positive result, a colored line appears in the lower section of the result window. This is the test line T. Even if the test line is very faint or not uniform, the test result should be interpreted as a positive result. If no control line C is visible, the test is always invalid. For diagnostic purposes, the results should always be assessed in conjunction with the patient's medical history, clinical examination, and other findings. The SARS-CoV-2 rapid antigen test from Roche Diagnostics offers reliable and fast results wherever they are needed. In uncertain times, your greatest asset is knowledge. It is time to expand testing with the Roche SARS-CoV-2 rapid antigen test because patients and their communities need to know.